Welcome to the 542nd episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome and thanks for listening. Well, we're having chilly weather down here. We've had a couple frost. I'm wearing winter running gear, but getting out because, you know what? It's good to practice the winter gear because I might get to use some of that gear in Colorado this year at midnight coming up over Hope Pass. So it's good to get your outfits ready in advance. I am still doing intervals. I got to tell you, I cut the rest walk down a little bit this week because it was cool enough that I didn't want to walk. It was kind of chilly, actually. So I ran a little bit more, but I would let my heart rate come down. And I'm still seeing really nice swings downward in my heart rate at about 2 minutes. I'm down to almost a walking level, resting walking level heart rate, and then let that recover a little bit and go up. So I'm still pushing paces that I haven't pushed for quite some time and feeling good about it. So my ankle's holding up and all is well. Next race is long play in March. So we're starting to bump the miles up, so that's all cool. I had a nice visit this week from members that live out of town, Lori and Bob Campana, and as we were having a discussion on different things, they asked me if I knew Dr. Kevin Elko, because Dr. Kevin Elko is in the West Virginia University Hall of Fame. He got his PhD in sports psychology from there, and embarrassingly, I had not heard from him, but they said he'd be right up my alley, so I went digging and found some podcasts, and yes, indeed, Dr. Kevin Elko is up my alley. So thank you, Lori and Bob, for that recommendation. One of his podcasts, and he has several books out. I would encourage you to check it out. I would love to get him on the podcast. I don't know if somebody like me can get access to somebody like him, but, it's worth a try. I'm not below or above cold calling people and making a long shot, but I heard him on a podcast, and one of the things that he teaches is the importance of belief, and he actually has an acronym, BELIEVE, and the words, the letters stand for B for bold, and declaring what it is that you believe in and boldly going after it. Energy, E. L is for love. I is for intrinsic motivation. E is for encouragement. V is for vision, and E is for evaporate. And we're going to circle back around to that later in the podcast because I think it certainly is fitting for some of the things I'm going to talk about. But actually, he's an excellent interview, so go ahead and check him out on whatever podcast you can find and check his books out. There was a study published in Journal American Medical Association looking at Lp(a). And so Lp(a) is a genetic marker that predicts an increased risk of cardiovascular disease. Probably has something to do with the LDL particles being a little bit more sticky and inflamed. And I've talked about Lp(a) in the past, but it is one of those tests that you don't have to get every 3 months, because if you have Lp(a), it's a genetic marker, and chances of getting it to go to zero are very, very slim. There are a couple drugs that may lower it some, but nobody knows what that means. But this study looked at what does it mean looking forward as far as cardiovascular risk over a 30-year period. And they used data from the Women's Health Study that originally started in 1992 to 1995, and it ended in 2004, but there was follow-up data to 2023. And so they looked at 30 years going forward, people that were otherwise healthy at around 50, 55 years of age and had their Lp(a) drawn. And they divided them into ranges, less than 10, 10 to 30, 30 to 60, 60 to 90, 90 to 120, and greater than 120 as being severely abnormal. And then they also divided them into percentiles, 50th percentile, 51st to 75th, 75th to 90th, 91 to 95, 96 to 99, greater than 99 was a Lp(a) that was greater than 131. And percentiles means that, you're worse than 99% of the other people if you're in the 99th percentile, or you're in a league of your own, so to speak, if you're really abnormal in this. And they looked at whether those people had major cardiac events, such as myocardial infarction or bypass or stents, whether they had strokes or deaths from cardiovascular disease, including deaths from surgical procedures, which would be death from a bypass or stent. And they came up with an initial population of 28,345. It got whittled down to those that had an Lp(a) of 27,748, and then they ended up with 23,179 people that actually were in the study. And they looked and divided those people into the Lp(a) number, so the 10 to 30, 30 to 60, and they also looked into the percentiles, 50th, 51 to 75. So when they looked at major cardiac events, all cardiac events, there were 3,707 in the group that were looking at the number, and 3,165 into the percentile group. There were 1,985 fatal and non-fatal cardiac events, and 1,696 in the percentile group, 1,041 and 807 respectively in the fatal and non-fatal strokes, and 1,543 and 1,325 in all cardiovascular deaths out of the 23,179 people followed for 30 years. They took into account other risk factors and controlled with their mathematical models, but about 25% of the population had high blood pressure, 12% were smokers, 10% drank significant alcohol, only 3% had diabetes, 46% were getting hormone replacement therapy, and if you looked at the LDL over the range, it was someplace between 117 and 146. The C-reactive protein was in the normal range. And what they came up with was that the more elevated your Lp(a) was, or the greater the percentile, the worse risk of significant coronary artery disease. It didn't hold out for CVAs and overall deaths. Greater than 120 blood tests was the worst risk. And again, this was over a 30-year period. So the people that had the highest Lp(a) had a 20% risk of some major event over that 30 years, versus people that had the lowest, near normal, had a 12% risk over the 30 years. The baseline age was 50, so you can say, by year 30, they're 80 years of age. That's a difference of 8%, highest to lowest. So the takeaway from the people that wrote the paper was that, my gosh, this is, these elevated, we can really predict what people are going to die from or what's going to happen to them over a 30-year period, and we've got to, get these people and screen everybody for Lp(a) and treat them accordingly. Starting at age 50. But again, that takes into account our ability to, we're, again, as physicians, we're trying to predict the future, which we're not much better than the weatherman in reality. A little example I'm going to give you is that I have an 82-year-old that has an Lp(a) of 81, and she's had a calcium score that was only minimally abnormal with a few, mild degree of calcification. She eats a plant-based diet. She's active. She has absolutely no symptoms. She got her Lp(a) because she wanted to know what it was. She got a calcium score because the doctor recommended it, but she feels fine. So she's outlived the predictions of this study, and that's not, she's not an exception to the rule for the most part. She has the ability to look back and say, I made it, so to speak. And she said, well, maybe this would be good for my nieces and nephews because there's a family history of Lp(a) and they can change their lifestyles. And I think that's a great idea, is changing your lifestyle to try to make yourself the healthiest you can be. But the other side of that coin is, oh, I have this terrible risk of cardiovascular disease, and this is going to be what takes me down, and I've got to do all these interventions that I possibly can and get all these scans. Might we make those people worse at 50 now if we went back and we started, doing interventions? Because obviously some of the cardiovascular deaths were due to interventions. I'm sure you've heard, and I hear quite often, people tell stories of, things that have happened and people that they know, and there's always the story of so-and-so was given 6 months to live, but then they lived longer. And even Dr. Elko talked about his grandmother and the story that his father was upset and crying, and he was told that his mother had only 5 days to live because she had a rare form of leukemia. And Dr. Elko, as a child or a young person, went over to his grandmother's house, and he said, "I'm so sorry." And she said, "Why?" And he said, "Because I was told you have, this bad disease and only 5 days to live." And she said, "Who told you that?" And she said, "Well, the doctor said." It's like the doctor doesn't know anything. I have things I have to do, and she lived 5 more years. So, again, I think you have to take somebody's ability, that if they're so confident in their ability to predict the future that much, I might consider getting another doctor. Because I know I've been doing this a long time, and I don't have the crystal ball when it comes to who's going to live and who's going to die. Again, back to the weatherman. We always say weatherman. Weathermen can't predict the future. We don't talk about weather women not being able to predict the future. I would guess, and I haven't paid attention, but I'm going to in the future, weather women would probably say, it could rain, so maybe you want to take an umbrella. So you might have an Lp(a) or high cholesterol. You might want to do something to change your diet or, change your outlook, but I'm not really going to give you a timeline. And we all know that positive mental outlook is associated with increased longevity. So for a doctor to tell somebody that, you got 6 months to live, that's not really pumping them up and giving them much positive outlook. Super Bowl Sunday is this weekend, and there is a player for the Seahawks, Derek Hall, who was a premature baby at 23 weeks gestation. He was given just a 1% chance of living. He's playing in a Super Bowl now. I saw a picture of him. He's a very large man. I guess all Derek Hall needs is about a 1% chance, and he's probably good to go with just about anything. Again, it comes back to what you believe in and what you can do and who believes in you. But as Dr. Elkin would say, we have to start with belief in our own story. All those stories have one thing in common, though, is that the individual was responsible for doing the work that markedly improved their odds. There were no hacks, gimmies, predictions, somebody trying to tell the future. Nobody went to Derek Hall and said, "I had this vision, if you can just make it to 2 months, you'll make it to the Super Bowl." I'm sure no one thought that he would be a football player, let alone make it to the Super Bowl. On the other hand, if somebody had a very low Lp(a), they might think, well, I'm free. I don't have any worries. I can eat what I want, do what I want, and I'll never have heart disease. And we know pretty much that that's not true either. So one of the markers or one of the risk factors for cardiovascular diseases we've always used is family history. I can remember being a medical student, taking my first history and physical, and you got in big trouble if you didn't ask about the family history. And when you're a third-year medical student, they want you to ask about everything. Measles, chicken pox, any kind of disease you can think of. Did anybody have it in your family? Just to, I think, keep a third-year medical student busy so they don't bother the rest of the team. But anyhow, we look at family history, and some people say, well, yeah, I had a family history of heart disease. My grandmother died when she was 90 of a heart attack. Well, if you live to be 90, you got to die of something, and your heart's going to have to stop. So that's not a family history. When we talk about family history, we're talking about people that have heart disease in their 40s, 50s, 60s, sudden death, so to speak. There could be a genetic marker from that. And it's what drove me to be a cardiologist, because I have a strong family history of cardiovascular disease. My grandmother died at 72. My other grandmother died at 56. My grandfather died at 48. That's a strong family history in my book. That counts. But let's look at it a little closer, because our family history might not be as much genetic as environmental. My grandparents that died in their 40s and 50s were Italian immigrants. They both smoked. They had two small businesses, eating when they could, bad food or, cheap food, lunch meats. They had a bar. My grandfather worked had a little coal mine, worked long hours, chemicals. It was in an area in West Virginia where there were strip mines, and the creeks were actually orange. I can remember as a kid being at the bar and watching the orange water run under the bridge. So chemical exposures, bad food, overweight, smoking, no medical care at all, until my grandfather died suddenly, so he had no medical care. And my grandmother had multiple trips to the emergency room in a hospital with congestive heart failure in the last year or so of her life at 56, but no ongoing care before then. So she had diabetes, no education, no nothing. And frankly, back in the 70s, there wasn't a whole lot. A couple oral medications, very few blood pressure medications. And again, you'd have to go to the doctor or see somebody to have that taken care of. So they died young. They had 4 children, my mother being one of them. The kids all had the same early exposure to the Sulphur Creek. Some of the food. My oldest uncle lived to be 80. He was an All-American wrestler. He was the first in the family to go to college. He died of coronary artery disease at 80, sudden death, in a high-stressed environment. Not the best eater in the world, but otherwise looked pretty good on the outside, but he made it to 80. He was also he had the demeanor of a wrestler at 80. If you've known any wrestlers, pretty short fuse. Not much of a response other than he went to 0 to 100 in 4 seconds or less as far as his temper. So I'm sure that didn't help much. But anyway, made it to 80. Another uncle made it into the 60s. Smoker, poor diet, overweight, diabetes. Had a terrible stress event in his life that, frankly, took most of his motivation away to live. Died young. Another uncle, poor diet, a lot of alcohol, very toxic childhood. Again, it was his father that died at 48 when he was 12. A lot of childhood issues. Made it into his 60s. And then there was my mom, who made it to 90. She had high blood pressure and high cholesterol for 50 years, diabetes probably for 30 plus years. Weight was never huge, never smoked, had an extremely positive mental outlook, believed in herself, had an incredible drive, worked 2 jobs, never stopped, never knew a stranger, was there for everybody. Often, most of my college friends' mother, a lot of adult friends' surrogate mother, was just always there to help and serve. Lived to be 90. My other grandmother, diabetes, at a young age, probably at least in her 50s. With no test other than a urine test once a year to see if she was peeing sugar in her blood, which I think she did. She took 1 medication, never had a blood pressure pill, never had her blood pressure checked that I knew of, never went to the doctor, and had a massive heart attack at 72. She was told not to eat sweets. My grandmother never ate out. She never smoked. She worked hard in her younger years, and had some stressors. Was outside in the morning, but she was pale skin, fair skin, didn't spend a whole lot of time out in the sun. She had a hip fracture, didn't do much afterwards, so fairly sedentary, overweight, but not nearly what we would call severely overweight. So more lack of medical care or intervention or lifestyle modification, perhaps. when people talk about saturated fat these days and it's better than seed oils, well, my grandmother used lard to cook and she used a lot of sugar. So there was, things were made with lard and sugar, just about everything were the main ingredients. But so I can't really look and say that those two things didn't affect her longevity. I had an uncle, had a heart attack at 50. That would be considered young. He smoked and was overweight. After he had his heart attack, nothing was done. It was back in, again, the day where you just had a heart attack, and then he was told to walk 4 miles, and he did, and lose weight, and he did, but he still had the same diet. But nevertheless, he lived to be 89. So, there's a lot of things that you couldn't predict out of that family history that would say, well, you're in for it. What it did do, it spurred me to become a cardiologist and see how I could do lifestyle modifications to help people not succumb to cardiovascular disease. In the beginning of my career, it was through medications and perhaps intervention and, the thought of early detection, but certainly exercise and eating right. That's evolved tremendously over my practice. It was initially American Heart Association, more of a Mediterranean type diet, became more of a plant-based diet. Now I'm circled back to, we got to get our omega-3s in, so add some fish back into the diet. But and the practice evolved into what we have today, which is a plant-based wellness program that has been going on since 2015. And so recently I decided to look back through a patient population and see how good are people doing. And I talked about in a podcast a few episodes ago about, when we did people's DHA levels, they were pretty low. And come to find out when I do their cholesterol levels, there aren't that many that are that 150, 160. Just not making it. Hemoglobin A1Cs, a lot of people have them in the 5.6 range. Only a few have them in the high range, 8 or 10, struggling to get them down. Most are trying to eat plant-based with some fish most of the time, and they're all doing okay. None of them have a heart attack. I haven't had to do a heart catheterization. So they're trying to move and they're doing the best they can and they're doing okay. The thing that most of them have in common is it's a plant-based wellness program. They want to be well. They are taking responsibility. They are owning their health. They don't want to be told what to do. They're doing the best they can. They're moving. Most of them, some can move more, but they're moving. And they're doing okay. So when I circle back around to early testing, early in my career, was do a stress test on everybody, or do these screening tests, or do LP(a), or, cardiac calcium scores in an asymptomatic patient. I'm not sure what to do with the answer. The question is, what does a person want, and what is your motivation? And I'm going to come back to Dr. Elkin. How do you be a 1%er? What are your beliefs? Do you take ownership of your health to do the best that you can? Are you living your life boldly? When people say it's not that easy for me, or I'm trying, or diets don't work, that's not really taking ownership. That's allowing yourself to have a cop-out, because it's not zero. And it's at least 1% chance of working. So if there's 1% chance of working, like Derek Hall, then you probably can do it or find a way if it's really important. The people in my practice that have a vision and are determined, you can't stand in their way. They've taken some hard knocks along the way, and they keep going with a positive attitude. I will bet you that there are not that many stories on Super Bowl Sunday about the children of successful professional athletes doing great things, because they don't have the hunger. The people that the stories will come from are people that struggled, the 1%ers, that didn't have it given to them, had to fight, had to believe in themselves before other people believed in them. We're intrinsically motivated. Most people that, their children, a lot of them aren't. They don't have to be. The hunger is not there in a lot of them. There were very few college graduates in my family, and no one had ever gone to medical school. And so I really didn't voice that well until college. There are other people in my family that went to college and became teachers. But I had a plan. It wasn't necessarily a well-oiled plan, but I had a plan on how I was going to get into medical school and how I was going to get my degrees and line things up so that they would have to accept me. Even though it wasn't written anywhere, there certainly wasn't any precedent for the way I went about it. But I was sure that if I worked hard enough and showed people that I could get 2 degrees in 3 years, that they would accept me into medical school. And I was okay with sitting in a chair. And I kind of laugh sometimes when people tell me that, so-and-so is going to go to medical school and they're still very young. And it's like, do they really want to? Because if you really want to, anybody can get into medical school and work hard and sit in a chair, but it requires a lot of time sitting in a chair. It requires giving up a lot of things that most people don't want to give up. So it's a choice. But it was my choice, and I made my plan work. And I was okay using every bit of my energy to get to that, to be able to do that goal that I wanted to get. And that's a lot what Dr. Elkin says. You have to use your energy to make it happen. There's no reason to conserve it. There's no reason to hold back. But if it's something that you want, make it happen. The L, love, believe in someone else. Be someone else's blessing. That is one thing that he said. Find the good. That's one thing that I can say for sure that my mother was very good at, being somebody else's blessing. There's nothing better than making someone's day. Encourage someone else. If you bring others up, you'll rise as well. We have running clubs that people join together and support each other in the community. It's a great thing. The ultra community is one of the things that I love most about the running ultras, besides running out in the woods, is the support. Strangers supporting strangers, bringing everybody up. It's not about beating someone. It's about helping someone else to cross that finish line. I will be forever indebted to my crew that, help with these races. They give up their time, encouragement to try to help. And you see everybody else's crew there, just, people that, parents, friends, giving up their time to help others achieve a dream. And it's everybody's dream. It's everybody's win when somebody else accomplishes their goal. Have a vision for what you want. Don't be afraid of the future. Don't be content if your LP little a is normal, but it's not a death sentence if your LP little a is elevated. Have a vision for how you want your health to be and how you want your health span to be, and work that. You don't wait till you're 90 to be healthy. You work it from the get-go. Most of the people in the women's health study, they had some risk factors, but again, if you were in the women's health study, you had a goal to at least take some initiative in your health. The last letter on that believe is evaporate. Everything will go away. Everything will evaporate, including you. So make every day count. To me, that's the most important. I talk about who would I have lunch with. If I wouldn't have lunch with you, then I probably don't want to spend time with you. There's no reason to be around negative. You give people your best encouragement, but there's not enough time to be around negative or pessimism. So try to be that positive force. If you don't think you're going to win, you're probably not going to win. I liked my mindfulness coach, Susan Donnelly. How do you spin something around to make it more positive? Because there's always a chance. Until the clock runs out, there's always a chance. That's one of the best things about the Super Bowl is you hope it's a good game. You'd like your team to be ahead the whole time, but until the last second runs out, you're not sure. And it is amazing with these young athletes what level of effort they give to the very last second. So there's no reason why we shouldn't give our effort every day and whatever we do to the very last second. Make it count. No need to have today wasted because you're worrying about tomorrow or dwelling on what happened yesterday. So if you're thinking about getting blood tests and you're worried about the future because of your blood tests, no need to. Think about how you can do today. How well can you be today? What a great day you could have today, and the rest will sort itself out. There'll be Super Bowl parties and Super Bowl food for a lot of people and different celebrations. Go out in the morning, get your exercise in, make a dish that you can take to the Super Bowl party that's healthy. The other option is, eat before you go or have a nice meal afterwards, probably then afterwards, but eat before you go. But stay to your plan. You can celebrate without, eating a high salt diet. So stay out of the hot dogs and potato chips. We're going to make some Super Bowl food that's probably pretty good, just a lot of what we usually make. That's plant-based, but if you're going to do, if you're worried about hot dogs, make some carrot dogs. You can roll them in some pizza dough and make little pigs in a blanket if you like, and a variety of other different salads you could take to a party. But work your plan, keep motivated, keep your eye on the goal that you want to achieve. If you'd like some help trying to get healthy or sorting out some of the tests you've already had, we'd love to help. I'd love to help settle things down and get you pointed in the right direction. You can go over to our website, drdulaney.com, DOCTORDULANEY, and check out the website. Different ways you can join. We have multiple different levels, whether it's coaching, dietetic counseling, or just website perusing or full membership. We're there. As always, I appreciate you listening. Share it with a friend. Love to hear some feedback. Again, if you're a member that's online or $25 and you happen to be in Florida, come over and say hi. I'd love to see you. It's always nice to meet people that in person. Thank you again for listening, and I hope your team does well.